Chapter 1 Episode 28. Have you ever had a cough that lasts for weeks? Or maybe you're fine most of the year, but every fall, the cough comes back. Before assuming something serious is wrong, ask yourself two simple questions: when do I cough? And where do I cough? The pattern may provide important clues. If your cough returns around the same season every year, think about seasonal triggers. Pollen and ragweed can trigger allergies. Damp leaves and indoor moisture can increase exposure to mold. Cold air can also irritate sensitive airways. And for some people, these triggers can worsen asthma. Interestingly, some people with asthma mainly experience coughing, rather than obvious asthma attacks or dramatic wheezing. What if you start coughing whenever you visit someone who has a cat or dog? People often say they're allergic to pet hair, but the allergy is usually caused by proteins found in things such as skin flakes, called dander, saliva, and urine. For sensitive people, these allergens can trigger sneezing and itchy eyes, but they can also cause coughing, wheezing, or worsen asthma. Again, notice the pattern. Do your symptoms improve when you leave that environment? Here's another clue people may overlook. Do you start coughing when you're cooking? High-temperature cooking, frying, smoke, overheated oils, and other cooking fumes can irritate sensitive airways. Gas stoves can also produce nitrogen dioxide, or NO2, which can irritate the respiratory system and worsen asthma symptoms in susceptible people. So when you're cooking, use your range hood, preferably one that vents outdoors, and improve ventilation whenever possible. If you cough more at home, or in one particular room, look at your environment. Is the basement damp? Is there visible mold or a musty smell? Is your bathroom poorly ventilated? Are you regularly exposed to smoke or large amounts of dust? Improving indoor air quality won't solve every cough, but removing an environmental trigger can make a big difference when that trigger is contributing to the problem. Of course, not every cough comes from something in the air. A respiratory infection can leave you coughing even after you otherwise feel better. Asthma can cause recurrent coughing. Mucus draining from your nose into your throat can trigger a cough. Acid reflux can cause coughing, sometimes even when you don't notice obvious heartburn. And certain medications can cause a persistent dry cough. That's why treating every cough with the same cough syrup doesn't necessarily solve the problem. How long the cough lasts also matters. In adults, a cough lasting less than 3 weeks is generally considered acute. 3 to 8 weeks is called subacute. And a cough lasting 8 weeks or longer is considered chronic and should be medically evaluated. But don't simply wait 8 weeks if something feels seriously wrong. Seek medical attention sooner if you're coughing up blood, having significant difficulty breathing or chest pain, experiencing persistent fever or unexplained weight loss, or if your symptoms are clearly getting worse. And remember what we learned in episode 27, a normal blood oxygen level does not automatically mean your lungs are healthy. You can have asthma or another respiratory problem while your resting SpO2 still looks normal. While you're figuring out the cause, simple measures may help soothe an irritated throat. Warm fluids can be comforting, and honey has evidence for helping relieve some acute cough symptoms. Many Chinese families also use warm pear with honey as a traditional soothing drink. Warm ginger or lemongrass ginger tea can also be comforting when your throat feels irritated. But remember, these may soothe the symptom. They don't treat asthma, pneumonia, reflux, or another underlying disease. So the next time you keep coughing, don't just reach for cough medicine. Become a detective. When does the cough happen? Where are you when it starts? What were you doing? And how long has it lasted? The answers may help you and your healthcare professional identify the real cause. But what if coughing isn't your biggest problem? Maybe you're becoming short of breath. You used to climb 2 flights of stairs easily, but now you have to stop halfway. How can doctors actually measure how well your lungs move air? In our next episode, we'll learn about spirometry and 3 measurements you may have never heard of: FEV, FVC, and FEV divided by FVC.